We know in this country over the past decade we've seen a dramatic increase in the use of opiates and other drugs, but this is a whole separate issue. This is over the past 2 years, our drug supply in this country, the illicit drug supply, has been contaminated with a drug known as fentanyl.
Across the board, there's an increase related to patients presenting with depressive disorders, over 30%. There's an increase related to patients presenting with anxiety disorders. And we've treated over 2,000 patients since 2016. Well, in the last 6 months, we've had a rise in patients at the age of 18, 17, and 60 presenting to our healthcare system.
We see a lot of children that buy Xanax and Xanny bars laced with fentanyl and other drugs. And the problem is you don't know what you're getting. It's not like you're going to CVS or Walgreens and buying some Tylenol. You don't know how it's going to affect you. You don't know the concentration of it. You're putting it into your body, and the results can be deadly.
You can't trust, any product on the street. There's no regulation. When they're measuring, it's not that they're measuring 0.2, 2 milligrams, 5 milligrams, and they're being exact. It's an approximation.
A very, very small amount, we're talking microparticles in any pill or any powder, can lead to respiratory failure, which in turn leads to cardiac arrest and leads to death. And so it doesn't take much, a very, very small amount. Less than the nail on my pinky finger can kill somebody.
Teenagers going to parties, maybe end of the year parties, your proms, things of that nature, getting their hands on things like cocaine, even pressed pills like Xanax, and thinking that they're getting the product they're buying. And at the end of the day, the product that they're buying is now mixed with fentanyl.
A big concern that we have is that they are going to get exposed unknowingly to fentanyl, and then once taken, it can be too late. It works very quickly and it's very potent.
This fentanyl epidemic is affecting everybody. Patients that have a long-term opiate dependency or drug dependency, and people that have zero dependency on drugs and have just used something on a Saturday night or at a party and something was given to them. So you don't have to have drug dependency, to really die from this drug. It can happen from one pill. It just takes one dose.
Pediatric patients are more susceptible to death when using something like fentanyl. That's the concern, because it's called unintentional exposures. 85% of those individuals were individuals that consumed a product that was mixed, meaning they were consuming cocaine and it was mixed with fentanyl. They were consuming a benzo like Xanax, it was mixed with fentanyl. MDMA like a Molly mixed with fentanyl.
I've been dealing with drug overdoses for the last 32 years, whether it's a recreational drug overdose, an intentional drug overdose, or an accidental drug overdose. For me, it's one of the most tragic situations because 5 minutes ago, your child was fine, and now they're not.
Nothing is harder for me than having to speak to a mother or a father and look them in the eye and tell them that because their son or daughter took one pill or used a little bit of some drug, that they're no longer with us anymore. That's the hardest part of this job.